So what parts of your body make sex hormones? Really, the answer is all parts, because they all communicate. But your brain is incredibly important in sending signals to your ovaries, to your adrenals. Your uterus actually has receptors that physically can tell the rest of your body what needs to be done. So when you think of people who have had a hysterectomy or an oophorectomy or both, they've gotten maybe their eggs or their ovaries removed, they've gotten their uterus removed. That actually can influence what your hormones do. So what organs and systems actually affect hormone production? If you think about menopause, you're thinking of a decline in estrogen. The biggest problem with women today, and I cannot stress this enough, is that our estrogen starts either declining, or we'll get to this in just a second, but you might have heard the words estrogen dominant. What that actually means is that your estrogen's just out of a healthy balance. Whether it's high relative to another hormone, whether it's super low, unfortunately, our surroundings and our environment and what we eat and what we eat out of, whether it's plastics, whether it's chemicals, whether exposure, has really kind of set us up for having a really big hit on our hormones long before they had to take that hit. And so it really is important to kind of meet yourself where you're at, especially if you start noticing that your periods might no longer be every month, or they're every month, but they have changed. Suddenly you notice that they're heavier. Suddenly you notice that there's more clotting. That's the beginnings of perimenopause for a lot of women. But I often hear that women say, well, I'm menopausal, I haven't had a period for 3 months. Please keep in mind that in order to actually be considered fully menopausal, you must be without a period for 1 entire year. And women always ask me, well, it's been 10 months. I had no period and then I got one. The countdown starts over. If you're already coming into it with a hormonal imbalance, it really sets the stage to feel like you're not really riding a wave that has these gentle ebbs and flows that you can navigate, but it's really when things feel like they're either really, really highly disruptive, or you're in a really, really low state where you don't even know what to do next. So the goal is really to find that balance, because as you can see, all of these different systems affect hormone production.